Well, we are back with Dr. Jackson. Dr. Jackson, shed some light on this next kind of question I have here. Many people, we have missing teeth, 2, 3 more. Usually we have them missing in the back, because if one misses front, frankly, we run to a dentist rather fast. It's ugly. But in the back. And we don't think much of it. We go, well, I chew on the other side. Or like somebody like me, I don't chew much in the first place. You know, my wife is on the first bite of her salad, and I already finished with the steak completely. So, so it wouldn't matter if I have teeth or not. I just swallow this thing. And I know all about not supposed to do that. But the point is, we don't necessarily fix our teeth, and nothing really bad seems to be happening. And yet dentists keep telling us you've got to replace those missing teeth, otherwise all havoc will break loose. Can you shed some light on it? Can you tell us a little bit, why this apparent it doesn't matter, and on the other hand, this you've got to fix it comes from?
Right. Well, from the patient standpoint, the front teeth seem to be more important because that's what they speak with.
Well, we understand that.
But from a health standpoint and a dental standpoint, the back teeth are pretty important, sometimes more important than fronts. The reason we ask you to hold on to the back or to go through so much to save the back teeth is because they support your musculature in your face. They support your chewing, the way how much you're going to chew your food, and how well and therefore how well you digest your food down. The back teeth are because they're the main teeth for chewing. When you don't have any, you start using the front teeth. And what I tell people is then they start having that splayed picket fence look, where the teeth are all splayed apart because they use the front teeth, which are not meant for chewing food up constantly. And not meant for, it's meant maybe for biting off, but not chewing food up enough to digest it down. And so the back teeth are very important to save them, to keep them healthy. And that's and because you can't see them, that's one of the reasons why you need to be at the dentist regularly in order to have regular checkups. And if there's something going on, maybe it's a little cavity, and we can we can catch it early, treat it, and prevent it from becoming a problem later where you would need root canal treatment or extraction. If it's something that's that we think needs further treatment, such as you have bone loss, then we can send you to a periodontist or a specialist early, versus having you think that you're diagnosing it yourself correctly and then you wind up losing all of the back teeth. So back teeth are really important.
Let me ask you, Dr. Jackson, so what you're telling me is, it kind of the phenomena of, like, if you have a fence and you have some posts missing, and so because one is missing, the next one start going all crooked, and then the fence loses his functionality. It would, people can crowd in and out, dogs can come in and out, and also it looks awful ugly. Now, it doesn't work anymore. Or from another viewpoint, what you said that muscular, so basically what you're saying is the jaw becomes unaligned. It gets wacko. So it gets crooked.
And the cheeks begin to, you'll notice people will have the sagging cheeks, the puppy dog look, where it's kind of sagging or sucked in. And also the tongue increases in size because there's nothing holding it in. So the tongue can increase, which makes it more difficult later on if you do decide to get replacements when you've been without teeth a real long time.
Not just that, Dr. Jackson, but, you said it very clearly. You start looking ugly.
Yeah.
Who wants to look ugly? Who wants to look 4, 5, 10 years older than he is? It's bad enough. It's bad enough to look as old as we are, but that's acceptable. We okay with that. You know what I mean?
Right.
But looking older only because you lost some teeth and you start looking crooked. From an engineering viewpoint, I can see that it's the hinges that they have to work. You crooked. And let me ask you. I've heard from people that because of that, not also do you start having a saggy face or a caved-in face, and as I said, then people go and have Botox and all kinds of stuff when all they really needed was keep their mouth okay. In many cases, I've also heard that type of malalignment, those misalignments because of missing teeth, everything tries to adjust, also causes neck tension, shoulder tension, and even headaches. Is that true?
It can, because the jaw, the teeth are no longer touching in the back. It can cause headaches. And of course, if you have headaches, then other things can come about. And the main focus I look at is the function of digesting your food properly. And the teeth, the mouth is the beginning part of that process of digesting food. And so the headaches can come about, the digestion problems can come about. The back teeth are just important teeth. And if something happens where the teeth are not able to be saved, or the patient is not able to save them because it may be just too expensive financially, then I always suggest that the patient gets replacements immediately. There are different types of replacements, but at least if they're replaced, then they restore most of that function or more than zero back.
Right. So basically we have at least 2, 3, or even 4 things which really affect a person. He cannot chew as well, no matter what he does and no matter what he thinks, so digestion is inhibited. If that doesn't worry the person, that's bad for him. However, then we have you're not looking so good. You get a caved-in face, a fallen down face. Now that should worry everybody. I mean, never mind not digesting, but I mean, at least a few years you live, you should look good. Then you may get shoulder tensions and headaches, which in itself, I mean, that robs you from sleep, and just makes life more difficult. I mean, you cannot produce and work as happy and make love as happy. Everything is a problem when you have those problems. And all those problems with time will compounding, meaning accelerate, get worse and worse. Or they're not just staying linear, like, a little headache. No, it gets worse and worse and worse and worse and worse. Doesn't mean everybody having a headache, it comes from bad teeth. But let me ask you this. If a person has headaches, has that muscle tensions, and tried a few things, tried chiropractor, ate a share amount of Tylenol, and there it still is, would it be wise for him to go to a dentist and see whether his mouth is misaligned?
Yes, that is. I mean, one of the things that we try to make, that dentists try to make the patient understand, is that your mouth, your oral health, your dental health affects your entire body. And so if something is going on that can't be diagnosed, or they're looking for where the source is, and that patient does have missing teeth in the back or poor alignment on the back areas, that would be a concern to be addressed by a dentist.
Okay.
So yeah, I would say yes.
All right. Wow. Here we have it. Very informative, Dr. Jackson. Thanks a lot. Bye-bye.